About what, I think 90 points or so. The Nifty Bank is down 3/4. Nifty Bank is corrected more sharply. And on the Nifty, we got just under 0.5% cut. Now, one of the things which many were talking about yesterday was as one of the reasons, incremental reasons for the market starting to get a little jittery is this new COVID variant, right? Now, the new COVID-19 subvariant has been detected, and as of yesterday, a total of 341 cases have been recorded, with 292 cases coming in from Kerala alone. Now, is this serious, and what are the implications? Let's welcome in Dr. Sandeep Budhiraja. He is Group Medical Director at Max Healthcare. Dr. Budhiraja, great to have you with us here. Thank you very much for your time. Prashant this side. Just that question, I mean, is this COVID variant serious? I mean, and what should viewers know about this?
We are calling JN.1 is from the same lineage of Omicron. And as we know, Omicron has been the prominent strain now since November of 2021. So it has not really mutated in a way we were seeing first 1.5 years of COVID, where you were getting alpha, beta, and then delta wave, which created havoc. So it's been a stable lineage of Omicron. Of course, it has kept mutating over a period of 18 months or so. And the latest mutation is this JN.1. Now, what is important about these mutations, and particularly about this strain which we are talking about, is because of these specific areas where there have been mutations, this virus is more transmissible. So person-to-person transmission is more effective and faster. So that means it can spread more widely and in a shorter span of time. But the good news is that the disease it will cause, or it is caused so far, has been mild. So it has behaved no differently from the Omicron strains we have been seeing for the last 18 months. So most of the people will be presenting with simple flu-like illness. So, fever, cough, cold, runny nose, sore throat. So symptoms are more limited to upper respiratory tract. That Delta thing where people started developing pneumonias and hospitals were overwhelmed and the mortality was very high, I don't think we will see any of that. And the reason for that is because, of a very good coverage of vaccination in India. We know that over 95% of Indian population has been vaccinated. And multiple natural infections which people have gone through. So it's a combination of, or we call it as a hybrid immunity, which people in India have got. So I don't think that it will cause any serious severe illness. It may cause a slight upsurge in the numbers, but most of the time this illness will be mild. Only thing we have to keep a watch on is for elderlies and people with comorbidities. So the antenna and guard has to be high. People need to be cautious. People who have symptoms and infections should wear masks, avoid going to crowded places. And if you have these symptoms, consult your doctor. But I don't think absolutely there's any need for panic.
I mean, so it's basically more infectious, but it's extremely mild, just flu-like symptoms, right?
Exactly, yes.
So obviously no need to test or anything. I mean, you just go to the doctor and, get treated for a flu. It's like, it's a flu.
So
thanks for clarifying
the testing will be decided by the doctor, but the government needs to increase its surveillance and do more genomic sequencing just to keep a watch as to how it is trending. This strain has increased from 3% globally to 27% just in about 4 weeks, and had 41 countries. India is one of those. So I think it is clearly increasing globally. But the disease being caused is mild, so mainly cough and cold. So I don't think there will be too many hospitalizations or deaths because of that.
So far, have you seen any hospitalizations, not just in your centers, but in your industry? I mean, what are the numbers looking like at the moment?
See, there's a lot of flu which is going in the air, which is non-COVID. So the seasonal influenza virus, which is typically seen in this cold weather post-monsoon. So that upsurge we are seeing, and in fact, the number of flu cases all this year has been more than what we have seen in the previous years. And we do know that flu itself, which is the simple, normal, common flu or the common cold, does cause hospitalizations, does cause pneumonias, and does cause mortality, which is a normal expected trend, and that's what we are seeing. Personally, me or my colleagues in Delhi, NCR, have not seen COVID admissions, and whatever case reports we are getting to know is down south. So we know that Kerala is reporting cases, Karnataka is reporting cases, Goa has reported cases. So far, we have not seen COVID cases being reported in Delhi, but hospitalizations by what we call as ILI or influenza-like illness or SARIs, severe acute respiratory illnesses, which is due to other viruses, non-COVID viruses, we are seeing. And that's a normal annual trend which we see, which is no different.
Okay, all right, Mr. Budhiraja, we'll thank you on that note. Thanks a lot for joining in and giving us a quick update on what's happening with the COVID-19 situation. It's important to point out that at the moment it's just a flu-like situation. There are no hospitalizations, so there is no need to panic, just like there is no need to panic with the market fall. By the way,